All right, good morning. This is Senate Health and Welfare. It is Friday, January 30th, and we're taking up S64, an act relating to the scope of practice for optometrists. This is a bill that we asked for that came to us from government operations, and they'll probably take a look at it after we finish with it. Jen, trying to remember what level, have we been through a high level on this one, or is this our first? We went through it.
Might have gone through it last year.
Yeah, we went through it a little bit this year.
Not gone through with me this year.
Okay.
Would you like me to do a
Yeah,
high level walkthrough?
I think a high level would be
Set
helpful.
you up
And
for
then,
your, there's a lot of words in there.
and
Get
just so,
bogged down in those, but I think you want to hear from the experts.
but so folks know, this is the first day with the bill, and we have another day scheduled next week. And then as we go forward, we'll be looking at the issues within the bill and having other testimony on it. So, and I know there's a huge amount of interest on the part of both optometrists and ophthalmologists. I know there's a history of this with OPR. And I know that everyone has been hearing from all your friends who have been patients of either optometrists or ophthalmologists. So it's not a simple bill, and we'll take some time with it. Learning.
Right. You ready?
Yes, ma'am.
So for the record, Jen Harvey from the Office of Legislative Counsel. And we'll put the language up on the screen. S64 is an act relating to amendments to the scope of practice for optometrists. And it makes some changes to the scope of practice and also creates a new advanced therapeutic procedures specialty that would allow optometrists who had specific training to do additional procedures. So it starts out, we are in the Title 26, which is professions and occupations, and we're in the chapter on optometrists. And there are some definitions. The first that gets amended is the definition of the practice of optometry, and most of the first changes are really just a couple of modifications, but just moving everything down a level from a subdivision standpoint. In order to add a new subdivision 6 here that allows an optometrist holding an advanced therapeutic procedures specialty, which we'll look at, to perform a list of advanced therapeutic procedures. So there's a bunch of procedures that are within the existing scope of practice, and then this would create a new additional set of procedures that someone with an advanced therapeutic procedure specialty could perform. Surgery and laser procedures and other things. It does specify here that the practice of optometry does not include performing any of the practices set forth in section 1720, which is a section that is amended here. And there's a list of prohibited practices. So the practice of optometry does not include performing any prohibited practices. It adds a new definition of adverse, adverse event. Which is based on the definition from the existing definition of adverse event. I'll write down what it was, but from the patient safety surveillance and enforcement system. So just an adverse event, this term gets used, but when a bad thing happens associated with delivery of healthcare services. Adds definition of therapeutic pharmaceutical agent, which is a prescription or non-prescription drug used in the diagnosis, prevention, treatment, or mitigation of abnormal conditions and pathology of the human eye or its adnexa, which is a term I had to learn. This is like parts that adjoin an organ. And then certain things that therapeutic pharmaceutical agent does not include. Then we have renewal. So under existing law for renewal, optometry licenses must be renewed every 2 years. The same thing is true for licensees with an advanced therapeutic procedure specialty under subchapter 5, but they also during each 2-year licensure period must complete an additional 5 hours of continuing education in the advanced procedures. Section 3 is that prohibited list of prohibited practices. So there are certain things an optometrist shall not perform, regardless of whether they have the advanced therapeutic specialty. And that is, they shall not perform any ophthalmic surgeries with or without the use of lasers or injection procedures other than those that are specifically spelled out in this chapter. And it prohibits a number of procedures that I won't go through with you at the moment. I'll can at a later time if you want, but certain things that optometrists shall not perform. Also prohibits an optometrist from prescribing or administering a drug or other substance that is a Schedule 1 or 2 controlled substance under the Federal Controlled Substances Act, with one exception, and that is that they can prescribe, they would be able to prescribe or administer hydrocodone in combination with analgesics within a very limited scope, so not more than 72 hours and no else. Subchapter 5, Section 4 adds Subchapter 5, or amends Subchapter 5, but reframes it as the Advanced Therapeutic Procedures Specialty. And this allows an optometrist who is licensed under this Subchapter 3 to apply for an Advanced Therapeutic Procedure Specialty that authorizes them to perform specific advanced therapeutic procedures that are set out in the definition section. In order to qualify for this specialty, the optometrist must, they have to get the specialty in order to perform the advanced procedures, and the Board of Optometry can grant the specialty to an applicant who is a licensed optometrist, meets the applicable requirements for education and demonstrated competency that are in this section, and has completed the specific exam requirements. The educational requirements are a little bit different depending on whether whether the optometrist graduated from an optometric school or college prior to 2019 or 2019 or after. I think some of what is taught in those programs change at that point. So if someone graduated prior to 2019, they have to complete a postgraduate course sponsored by a board-approved organization with a minimum of 32 hours and specific didactic classroom instruction. Won't go through at this point, but we can at a later date. And an optometrist who graduated in 2019 or later does not have to complete the additional postgraduate coursework. My understanding is it's incorporated into the regular curriculum. There are also preceptorship requirements. So an optometrist has to do a preceptorship, working with a licensed practitioner, during which they gain at least 8 hours of clinical training supervised by the preceptor and demonstrate clinical proficiency with hands-on experience performing a list of procedures on live human patients. And the preceptor must either be an optometrist with a substantially similar scope of practice who's been licensed in Vermont or another state to perform the advanced procedures, because that's what they're going to be supervising and training on for at least 3 years, or an ophthalmologist, which is a physician who specializes in eye issues. The preceptorship has to involve direct and in-person supervision, take place in the state where the preceptor is licensed and authorized to perform the advanced procedures, and the preceptor has to certify that the optometrist is competently require the procedures and provide a log to the board. There's also an examination requirement. Again, this is all for that specialty, the advanced procedures, advanced therapeutic procedure specialty. The applicant must successfully pass written and clinical examinations administered by the National Board of Examiners in Optometry, and specifies at least 2 and any others required by the board by rule. And then it's possible for the board to issue a specialty to an applicant by endorsement if they are licensed and in good standing in another U.S. state, and they've been already doing this kind of work and in good standing with that expanded scope of practice in that other jurisdiction for at least 3 years. And then finally, it's required an optometrist to report any adverse event. That was one of those new definitions in the definition section, to an advanced related to an advanced procedure within 30 days. And then we have just a minor redesignation. And the act, so this bill was introduced last year in 2025 and had a January 1st, 2027 effective date. So if you move forward with this, you may need to move the effective date out to allow OPR to do the work that's required to get this specialty ready. But I will defer to OPR to tell you their time.
Okay,
That's the
we
bill
will
that
not
we have.
ask you to describe each of the surgical.
Thank you so much. Yes, that is not within my lawyer's.
Not your practice. We got it. Okay, thank you, Jen. Questions for Jen? Just sort of the order of the bill is pretty clear. And the conditions under which the scope would be expanded, the type of procedures that are included in the scope and those that are not.
Yes, I will let the providers and OPR describe to you the specific differences. I've heard them talk about it, but it's certainly not my area of expertise.
Thank you.
Yes.
And we'll come back to this again as we learn more. We'll come back and go through the deep dive. So we're going to go to OPR, to Secretary of State's Office of Professional Regulation, so we can understand the history of this and what it means. Great. So both of them up.
Thank you.
You sit there. Oh, yes, I'll push. I'm gonna reach this.
Yeah.
Yes.
There we go.
Okay. Thank you. Thank you so much for having us today. For the record, my name is Jennifer Cola. I'm the Director of the Office of Professional Regulation. And with me, Emily Carr, I'm General Counsel of OPRs. And this effort has certainly had a lengthy history at our office. We've studied this advanced specialty increased scope of practice for optometrists, I believe, since about 2019. That was before I was in the general counsel unit. Our former general counsel did, and our staff attorneys did substantial work studying these issues, working with the Vermont Optometrist Association, working with Vermont Medical Society, the Ophthalmologists Society, stakeholders, having public meetings. So we have done a really deep dive on this, and ultimately we do support S64. So I'm going to tell you a little bit.
Just, I think historically, some of us understand that there was a sunrise
Yes.
that was negative,
Yes.
and then there was a sunrise that was positive. Can you talk a little about that?
So yeah, so I'm going to talk a little bit about our sunrise.
Otherwise, we'll be talking about the hallways.
Yeah. So we'll talk a little bit about our sunrise processes and reports, and then Emily will talk a little bit more about the statutory features that really, to OPR, our lens is public protection and making sure that practitioners are safe. You've also heard testimony from our office this week that we really do want practitioners practicing at the top of their scope. That just increases the amount of healthcare access that people have in the state. And so our job is to make sure that there are ways that they can do that safely and confidently, particularly when we're talking about advanced practice. So we're confident this bill meets that, and we'll talk a little bit about why today. So yes, we released a sunrise report in 2020 after we did some study of these advanced procedures. And that report, I think it's linked in our testimony, and if your committee assistant doesn't, if y'all don't have that, we're happy to pull it out. But so the process for that report was that OPR met with the Optometrist Association, we met with EMS, we met with the Ophthalmologist Society, and we also met with some stakeholders who did not hold a public meeting during that initial process. But we did reach out to every single optometrist school in the United States, asking for more information about what they're teaching in their schools to see just like what are the educational requirements.
Is it 21 or 23 schools? Because I've heard both numbers.
Oh, great.
Well, somebody will tell me.
Great question.
Okay, we'll find. It's in the
It
twenty-twenty.
is in the report, yes,
Says
ma'am. I don't
21,
have
but
that.
I understand that there's 23, and that could be, maybe missing something.
Yeah, I don't have that exact number from me in front of me. Oh, no, it is right here. It's, we have 21. Now Vermont Optometrists Association is here today, so if I got that incorrect, they'll actually will correct
Got
it. So we contacted all of those schools and asked for more information, like in depth about what's being taught in these courses on these advanced procedures. And we heard back from no one. So I think that was the big jam up in the first process. You know, we just didn't have enough information to assess whether there's adequate education so that we can make sure folks can do this thing. So we also did reach out to patients who were identified by optometrists who had stories about access to surgeries and procedures through ophthalmologists, and talked to them about their experiences and where they felt like maybe there were gaps, problems with access and whatnot. So we talked to those folks, but there weren't too many that identified, you know, substantial problems. I think a lot of the problems were, you know, it's far away for me to drive and I've got eye problems. So, you know, I have to have somebody take me. And the other issues seem to be like needing multiple appointments when they were going to ophthalmologists versus if they could just access the care through their optometrist, they felt that that would be more efficient. So in the first study, we could not conclude that that the public would be protected if we offered this advanced specialty because we just didn't have enough information about the education. Then I believe there was a bill in 2022, and that was the Senate GovOps, and they asked OPR to go back and take another crack at it and look at every single state where these procedures are being offered, you know, get more information from the schools and do a deeper dive, you know, a couple years after we did that first report. So we did that again. And this time we also held public hearings. So I think we had 2 public hearings. I think there were about 70 people who participated. And we did a deep dive again on how every state who allows advanced procedures, you know, what are their requirements and what is the reporting back on like negligence lawsuits? What's the reporting back on complaints to regulators about optometrists who are engaged in these advanced procedures? Are they having higher rates of reporting? And, you know, we did not see data that really suggested that optometrists who were performing these advanced procedures had higher rates of malpractice lawsuits or had higher rates of complaints with the regulators about injury arising from these procedures. So in our 2023 report, we did that deep dive, and Emily is going to talk a little bit about our specific findings and recommendations from the report.
Good morning. With Ledge Council's walkthrough, hopefully I have some additional information to provide and it's not too redundant.
Okay.
So, yes, OPR's autonomy scope of practice report included recommendations and findings. And essentially OPR said optometrists with adequate education, experience, and with the 2 examinations could safely perform specific surgeries, injections, and laser procedures. And these are already set out in the bill. There's a list of them. I'm going to avoid listing them out and trying to connect the words. But also in the bill in section 1720, you will notice that there is a large list of procedures that the optometrist would not be able to perform. So we are trying to provide, as Jen mentioned, procedures greater access to certain procedures and by avoiding going to ophthalmologists. Also, OPR decided that we needed additional safeguards for the optometrists to be able to provide these procedures. And those are also included in the bill. But specifically, we want them to report every 2 years the outcomes of all advanced procedures for performed. And any adverse events within 3 weeks of occurring. And we also would like them to complete an additional 5 hours of continuing education every 2 years with their license renewal. And we need to clarify that optometrists with this specialty may prescribe and administer therapeutic pharmaceuticals that are prohibited from prescribing Schedule 1 or 2 controlled drugs, except hydrocodone in combination with analgesics, which would be allowed in minimum quantities. So I'm just gonna skip through my notes, find something that y'all haven't already heard about. So also OPR does support the scope expansion. And the bill implements most of OPR's recommendations from the 2023 revised report. In addition to the education and examination and the experience, they will need the 8 hours of working under a preceptor. And also they will need to be directly supervised by a qualified preceptor to perform certain procedures on live humans. There's about 7 of those procedures that they will be required to do before they can receive the specialty. In addition, I know that Ledge Council noted that we might need to extend the timeframes for implementation of this bill because we will have to do rulemaking and we will have to make some IT adjustments. Rulemaking takes about 8 months. So once this is passed, we would have to get the ball rolling on that. So we're asking for an effective date no earlier than July 1st, 2028.
And in our first report, I think we did also kind of do a deeper dive about each of these procedures and what they are. So I know that y'all are going to be taking more detailed testimony about that at some point, but that is included in OPR's first report. So essentially, yeah, I mean, because we were able to get information from those educational institutions about what's required in their curriculum, we really saw that post 2019, this is being widely taught in all of these schools. So pre 2019, we have that 32-hour course requirement just to make sure. That's not to say that some schools weren't teaching the materials before that, but after that 2019, it seems like all of the schools were doing that. So that's it. OPR supports this bill. We feel confident that the public will be protected because folks have adequate training, education, and they have to take those skills examinations. So that was really a hard line for us too. We did not want to not require that. And my understanding is folks will have to travel for those examinations, but that was a very firm red line that we felt was necessary.
Okay,
Great.
thank you. I do have a couple questions and the committee may have questions of you. And I understand that you said that the first report will have a description of the procedures and we do want to look at that. The 2 reports, Calista is going to be putting up on our webpage. So we'll have access under today's date for those. But my question of you is, how did you make a determination about which procedures to include or not to include?
I think that making the connection between what was required in the coursework and the curriculum and the skills examinations with respect to those specific procedures. My understanding is that that was the work that our office was doing to ensure that people would have adequate education around those procedures.
So, and did that include any communication with the optometrists in our state or the ophthalmologists in our state?
Yes, I mean, throughout this process, we worked with optometrists in our state and heard from optometrists in our state. And we also heard from MDs, ophthalmologists in our state. So we did engage substantially with those folks. Okay.
What was the other one? Oh, oversight. So you're concerned about safety,
Yes.
top of scope. And also sounds like you're very interested in access. So the oversight of these new procedures and the process, what does that look like through your office?
Right, so first of all, the training that everyone, that 8-hour preceptorship afterwards to ensure that hands-on clinical skill is there. I mean, that was a significant part of.
So, but no, but what I'm thinking is, sure, that's in place in the bill, and you're gonna
Yes.
have folks who will begin to engage with a preceptor, no question about it.
Yes.
And then you're going to have a self-reporting of problems.
That's right.
So how do you know that the preceptor and the practitioner are working together? What kind of reporting is there on that? And how do you know that the reporting for the good work and the bad work is there? And that the same question would go for Board of Medical Practice, I would think. So how do we know that?
Right, so like any of our professions, we have a robust enforcement process where people can make complaints online about any kind of service they receive from a licensed professional. And believe me, we get 1,000 complaints a year. We get
It sounds
1,000.
like the legislature.
Yes, exactly. So we get 1,000 complaints a year. We investigate probably 600 of those and prosecute around 200. So this area would be no different. Patients, witnesses, family members, anybody who wants to make a complaint to us about a procedure, we're gonna take a look at that. We're gonna screen it, and if it appears to have a basis in the law, we're gonna investigate that and get to the bottom of it. So just as in any of our professions, we'll have that robust enforcement process.
So it's a complaint-driven system,
Yes,
just like a lot of the other parts.
all of our other healthcare licenses. That's right.
Any questions, committee?
Yes, ma'am.
Oh, sorry. Okay, thank you. Thank you, Madam Chair. I was just wondering if you looked at, if there's been any follow-up from 2023 to now, 2026, in terms of the number of reporting, the cases of reporting across the country.
Yeah, so I was reading, and actually I'm glad you asked that question, because last night I was like, I need to do a little bit more looking into this since we've, completed that work around the report. And I was looking at a publication from an optometrist organization, a national organization, and it was an article from January of 2025. And they were showing, comparing complaints and malpractice cases against ophthalmologists versus optometrists who are doing these advanced procedures.
For the same procedures or for a total?
I don't think it was as drilled down into,
That could be a problem.
that could be a problem, but my
Apples to
understanding.
apples.
Yes, my understanding of that, and I'm sure from the optometrist associations, you're gonna hear more from them about this, but my understanding of the data is there's not an appreciable difference between ophthalmologists performing these procedures and optometrists performing these procedures. Like, there's no big statistical difference in malpractice suits or reporting to regulators about problems. Okay.
Awesome, thank you.
Yeah.
All right, so more.
Yeah, go ahead.
This might be a question for someone else, but do we know how many of these procedures are performed in our state every year?
That is not information I know off the top of my head. I'm happy if you don't hear that from the optometrist today. I'm happy to find that information.
That would be great. And then my last question. On page 11, where it talks about the preceptorship and the preceptor, for preceptor, there doesn't seem to be a definition for that in the bill. Is a preceptor a surgeon,
I think it talks about the qualifications of the preceptor, and it has to be
what page?
11, number 2.
Okay, I'm reading that.
Have to be a licensed optometrist in the state who's had authority to do these advanced procedures for at least 3 years. Or it can be an ophthalmologist, or it can be somebody from out of state who has the training and required licensure in that state to perform those advanced procedures. And the practitioner would have to, I think, be in that state to do,
Okay.
to do those.
Page 12, number 2, and starting on line 3, it says the preceptor shall be either.
Got it. Thank you. Awesome. This will be on more page. I appreciate that. Right, that's it for me, right?
Senator Benson, then Senator Cummings.
I just had a few items, and I looked at it, it's like, oh, my own license, so I understand the procedure and, it's also how complaints can be filed and so forth, but, and I thank you for your work and your diligence in really researching this and your support for the bill. I think is interesting because the people rely on those licenses to ensure that public safety is occurring. And so I think that's very important.
We took that very seriously.
And the other part of this is, and I know this from my own profession, it's because you hold the license doesn't mean that you practice in that field. It is up to each individual to actually practice within the range of their knowledge base. So just because they have the license doesn't mean that they have to perform that particular procedure. And it's also true that the patient, if they're not comfortable with that particular provider performing that procedure, they do not have to have that individual perform the procedure. So they're free to go through an ophthalmologist if that is what they are more comfortable in doing. So this simply gives within the authority their ability to obtain the required training experience to actually perform these services underneath that license.
That's right.
So I follow their craft.
Yeah, that's right. And one of the features of this skill that was really important also is that if you have this specialty, every time you renew, you have to have you have to meet CE requirements just to make sure that you're staying apprised of. Well,
Thinking realtors was up there too.
lawyers have a lot too. So, we don't regulate lawyers, but yeah, so we do have that CE requirement too, so that they're staying abreast of these procedures and, you know, maybe if there's changes or evolution in how these procedures are done. So,
Thank you.
yes.
I understand how this preceptor will work. Once we're up and running and we have records, I'm a little concerned about starting out.
Yes, ma'am.
That we're not gonna have anyone in, well, we may have someone that's gotten the education, but they haven't been allowed to do it in this state. So you haven't been allowed to do this procedure, are you really qualified? Because you haven't done anything in 5 years to supervise somebody else. And if we go out of state, how do we know that the person doing the oversight isn't somebody that's had a large number of malpractice or complaints, you know, until we get our own. Because if something goes wrong, this is gonna kill it for everybody. We'll go back to nothing. It just seems a little
tricky to get it going.
Yeah, a little loose at that.
I hear what you're saying. So first of all, these advanced procedures have been launched in 12 other states. I believe the number is 12. So in other words, they also have the same transition in getting the situation going. It was really important that we included ophthalmologists in being able to be the preceptors, because we do have ophthalmologists in Vermont who will help train optometrists to be able to do this
I'm
work.
not picking that up.
Well, you know, one can hope anyway. So we will have the ability to have ophthalmologists do that, and there is, you know, folks from other states who have the credential and who have that expertise can also oversee
I
that.
think-
So, but I appreciate
feel more comfortable if we said the persons from other states are actively practicing these procedures and we have a clean record. But I wouldn't want to see some enterprising person become a preceptor.
So if you feel that additional requirements for the preceptor would
Yeah.
be
Yeah,
helpful to
that
ensure public protection.
they have been actively performing these procedures and that their record is clear. I mean, I had a realtor's license, but there were several years where I wasn't practicing yet. So Senator, what I'm going to suggest is the comments that you're making now will be important when we go through bill markup. So don't lose your thoughts. And so, because we have a long way to go before we get there. We have a lot of people ready to,
And we've made a note of that. We'll get
Yeah.
back and have conversations about it.
there are a lot of questions like that.
Yes.
Okay. Another one?
One quick last one. 12 states have launched procedures. Do you know if there are others that are in the process of potentially launching?
I believe there are, and I would guess that the VOA would have additional information about nationally what the pictures look like right at this moment. But we'll look into it if we don't hear that today. So, yeah, thanks. Great.
Thank you.
Thank you so much.
We're good.
Appreciate
We're
it.
good. Well, we will have questions as we go along, so.
Happy
Not on
to
the hook yet.
happy to come back.
Okay.
Thank you.
All right, so we have Dean Barcelo, who's here. Soon as the chairs get. Musical chairs. So Senator, I'm sorry, Senator Morley has to be in another committee. Excuse me.
Do you, you're not just that, right?
Ready when you are.
Ready?
I'm Dean Barcelo. I'm the immediate past president of the Vermont Optometric Association. I want to thank all of you guys for taking time, and especially Senator Lyons for taking time from the busy schedule to hear us why this is important. I've worked my entire career here in Vermont, and I follow both my father and my grandfather in the profession of optometry in the same practice located in South Vermont. Because of that, I have a unique perspective on how optometry has changed over the last 3 generations of practice. There are no healthcare providers who practice the same way they did even 10 years ago. We work in an industry that's constantly changing for the better. Optometry has, on occasion, come before the legislature and asked for change to our statutory requirements and will return to ask again. In the past, this committee took testimony when we wanted to treat an eye disease called glaucoma. And for those who are here, you'll remember that you took testimony that said optometrists treating glaucoma would increase the mortality and the morbidity of our patients. None of that has come to pass. There's never been an optometric scope expansion in Vermont that was repealed, and there's never been one in the country that was repealed. S64 in its simplest terms asks the legislature to allow them to perform some additional in-office, straightforward chairside procedures. These procedures are performed by optometrists across the country and are taught to every optometrist who graduates from a doctoral level program in the United States. The bill is nonpartisan, has strong Senate support. It's passed 5-5 out of government ops. It has the support of OPR and it benefits your constituents. Sorry, you're fine. This legislation represents, as you heard, more than 6 years of careful work and collaboration. OPR supports the language and it's added its requirements for additional training of the Vermont optometric workforce. These requirements, when passed, will make Vermont optometrist path for advanced practice the most stringent in the country. Will be more than any of the, and I'll correct everybody, but more than 14 states that have substantially similar scope. The testimony we plan to present to this committee will address the national landscape, our extensive education and training in optometry school, which includes 8 or more years of post-secondary education and a curriculum requiring a minimum of 2,000 patient encounters. This education is why federal government, CMS, has classified optometrists with dentists, podiatrists, doctors of osteopathy, and medical doctors as physician status. It will also cover the positive impact on workforce capacity and the potential to reduce overall eye care spending in Vermont. The time is right to move this bill forward. Plus, we've been working on it for a while. It represents a clear win for Vermont patients and aligns squarely with the state's objective of strengthening rural healthcare. Meaningful engagement with stakeholders is essential to address questions and correct misinformation. We're prepared to do so and are confident that the training, education, and evidence support this policy direction. The expansion of practice addresses several of the most prevailing challenges currently facing the legislature around healthcare. The reason for requesting this change is simple. It increases access to patient care. Patients can be seen sooner. That reduces wait times. They're often 3 months or more for an initial visit. It will remove redundant care, effectively reducing wait times not only for these procedures, but also for others we don't perform. It will decrease travel times by providing care closer to home and at a lower cost by moving this care into a more appropriate setting. Vermont is becoming less competitive on the national stage. There are 25 states that allow optometrists to practice at a higher level than the state of Vermont does. And as I just said, 14 of those have language that's substantially similar to the proposed language. We have submitted several documents, but the first 2 I'd like to share. This one is the 14 states, and this is the scope of practice for every state in the country. And if you'd like to review those, we've submitted.
Can you have those up under different names? Or do I have to refresh? Keep going.
Yep. Between my office in Bethel and here at the State House in Montpelier, we've lost 4 eye care providers who couldn't sell their practice and didn't have anybody come in. And so they closed up shop in the last several years. This legislation would help make our state on par with the education young professionals are graduating with, increasing the attractiveness to work here. Additionally, we all know that Vermont is among the oldest populations in the country. This means more medical care and in turn more eye care. Vermont has about 3 times more optometrists than our colleagues in ophthalmology. I have a second handout. The first here is the distribution of optometrists by county in Vermont. So with the exception of the top 2 corners, optometry has at least 3 optometrists in every county. If you compare that to ophthalmologists, there are only 2 counties that have 3 practicing ophthalmologists. That would be Rutland and Burlington. We have 5 that don't have any, and then there's just a matter of the performance. speaks to the distribution of eye care in our state. Ophthalmology is disproportionately located in Vermont's larger cities and towns. Additionally, the number of ophthalmologists is shrinking just when economists project an increased need for services. In an article published in the Review of Ophthalmology, published by Ophthalmology, they project a 12% decline in the number of ophthalmologists between now and 2035, but a 24% increase in demand. Please remember that ophthalmology often subspecializes in particular aspects of patient care, as their own article that I just pointed out points out. And that makes the number of ophthalmologists who are willing to do small in-office procedures even smaller. Allowing optometrists to increase the scope of practice will encourage more eye care coverage in rural areas. We've submitted a brief from the Cato Institute as well as one from West Virginia University that state that scope of practice changes expand access. Go ahead.
Dean, I'm gonna interrupt you because Felicity does not have the documents that you're talking about. Someone else may have sent them to me or Jennifer earlier, but if you could
I will make sure to have every
consolidate
single one. Yep.
those so we have them, because they have a lot of good data. Thank you.
So these research briefs state that scope of practice expands access to eye care. We present a paper from West Virginia, which concludes that states that support scope of practice changes for laser procedures benefit populations in non-metro areas disproportionately to metro areas, with its greatest effect happening in rural areas. In particular, and I quote, benefiting the elderly, low income, and marginalized populations. In addition to benefits to Vermonters, scope expansion will reduce the cost of procedures to the healthcare system. As this committee knows, procedures performed in a hospital setting have a higher cost than those performed in private practice, independent of provider type. Patients referred from private practice optometry to private practice ophthalmology still require a repeat examination to confirm the existing condition before the procedure is considered. This might be another full examination, additional testing, and serial visits in order for the ophthalmologist to be comfortable enough with the patient and the patient comfortable enough with the provider to proceed with the procedure. Each of these redundant visits increases costs to the system. We maybe haven't provided you yet, but we will. We provided a couple of graphs outlining two of the procedures that we're asking for, that are laser procedures. It compares doing it just in the optometry office versus a hospital and versus a private practice ophthalmologist. It's also worth considering that for many of the procedures we're talking about, they substitute potentially for medication, and medication is also a cost to the healthcare system. In conclusion, S64 will help Vermont. It will help address the projected future need for eye care as the number of ophthalmologists declines. It will increase access to eye care, specifically in rural areas, and will work to make Vermont more attractive to recent graduates. It will reduce costs to patients in the healthcare system as well. I would ask that you guys support S64, ask any hard questions that you might have, and let's talk about it.
Thank you. It's good. So can you talk really briefly about your role as the president of the Vermont Optometric Association, and maybe it's different from the Board of Optometry that oversees. And we're going to want to understand a little bit about the Board of Optometry, but how many folks belong to your organization, and do you have both, New Hampshire members? Or...
Sure. So the Vermont Optometric Association is probably best described as a trade organization. It's optometrists who get together. We help provide the continuing education for the state. That is separate from the Board of Optometry, which falls under the Office of Professional Regulation. They are really charged with making sure that the public is safe and administering licensure and answering questions and stuff. We sometimes answer questions about licensure. I get questions all the time. But there is sort of a distinct difference. The Board of Optometry, I suppose there is a mechanism for the Board of Optometry to pursue this. I think they are often reluctant to dive head in to legislation because they are also charged to protect the public.
we would ask, we're gonna ask the OPR.
Yeah.
Yeah, I understand the
So
separation.
it falls on the organization, Raw Optometric Association, to bring this kind of legislation forward if they advocate for it.
Yes, thank you. Senator Hewitt.
Thank you, Madam Chair. Thank you for your testimony.
Thanks.
Appreciate it. You mentioned that 4 eye care providers that closed in your region, were they optometrists or ophthalmologists?
1 ophthalmologist and 3 optometrists. Thought they might ask that. So I don't know if.
We'll get that stuff.
Yeah,
Oh,
Jane
yeah,
Kimberly,
Midnight reading.
yeah, right down the road. I don't know, my notes or
Thank you. I was
Yeah.
just curious.
Rick Lee, Barry Optical, Kimberly, and Dr. Stearns.
Okay. Questions in the house?
What percentage of, folk in your profession have the training currently that is now going to be required to perform the services, the expanded services?
Sure. It depends on whether we're running off OPR's definition or not. I mean, when I graduated from optometry school in 2009, I had gone through all of this. I performed these procedures, many of these procedures on live patients during my residency. Unfortunately, by the time we pursued this, it had been 10 years and those records are gone. I would probably tell you that somewhere between 10 and 20% of Vermont's optometrists have had like real extensive training in this. And I think you're going to find that my father's generation is happy to give it to other providers. We're really looking at providers who graduated in the last 10 years. That's an off the cuff.
Yeah, I was curious.
Yeah.
Okay. Other questions? I do have a couple of questions.
Go
So for optometrists currently, I know we're talking about wait time and the consolidation of folks in Chittenden County and other parts of the state. I don't remember my own county, but what are the current wait times for optometrists for their current service delivery?
To get an appointment in my office?
Yeah,
3 weeks, maybe.
3 weeks.
Yeah.
And so we'll, that.
I'm happy to call and ask.
I had a longer wait time, that's why I asked. It took me
Um,
6 months to get. But I like my optometrist. I also like my ophthalmologist.
Yeah, I think that varies a lot. Vermont is funny in the way that people flow when they travel for things.
Yeah.
I
Understand,
yeah,
population based is important.
I will tell you, I've seen more patients out of Montpelier and Bethel, Vermont than I ever thought was possible in recent years. And it's wild.
The other question I have is, so with regard to geographic distribution, if this were in place, how would we guarantee that the optometrists who are not currently situated would simply expand to their scope, and then the rest of the state would remain sort of little deserts here and there? How do we know that we would see an expansion of care provided from the state?
I mean, in a way,
I mean, it's probably question none of us.
you're sort of relying on capitalism to work there, right?
Exactly.
You move to the void. I think it will take time. The way this is written, somebody asked you asked specifically about how we're going to get the training kind of up and running from step one. That's something that we're pretty concerned about too. But we've been assured by the schools that they've got training in place and they have people who can work with us. We've actually been told by a couple of ophthalmologists they've looked with us.
That's good. I know that. The other thing is, a few years ago, we had a dental assistant bill, and one of the conditions we put in was that they had to start in the less populated parts of the state. So there were some of those conditions put in. I'm not suggesting that will happen here, but it came to mind as you were talking. I think that's it for now. I know that you will be back.
I'd be happy to.
No, we can talk about that. Yeah, that's been a huge discussion at the Vermont State Colleges, VSC.
It is interesting that dental therapist comes up when we talk. I assure you, when this passes, optometry will take this up for our patients.
Oh, I'm sure. Okay, we have. Do I have a full list of people? I have Dr. Nate Lighthizer here.
He's right behind me on the screen.
There you are. Thanks for being here. Did you want to stay up here?
Yeah, it's just no seats, I just.
Yeah. Okay. Go ahead, Dr. Lighthizer, welcome.
Thank you for having me. Good morning, everybody. Can you guys hear me?
Where the sound issue, two things. One, turn your volume up as much as possible and then get as close to the mic as you can.
Okay. Testing 1, 2, 1, 2. Can you guys hear me?
That's very good. Thanks.
Okay. Good morning, everybody. I hope you guys are doing well. My name is Dr. Nate Lighthizer. I am an optometrist here in Oklahoma, faculty member, and I serve as the dean of the NSU Oklahoma College of Optometry. So I'm one of there's currently, as you see, guys said, 23 colleges of optometry across the nation. I am one of the 23 deans. I happen to be the dean of the Oklahoma College of Optometry. Can I share my screen? Is that okay if I share my screen?
Got permission.
Okay, I'm gonna see. Can you guys see?
We see all the slides.
Can you see my slides there?
Not yet. No, there's nothing.
Yet. Okay.
It's done. Now it's you.
Now it's me.
Take your time. We're good.
I didn't see them, but they were all on the screen.
Yeah, it was all.
Okay. Let's see.
Single page.
Let's see if you can see it this way. I got two screens set up here, so that's why I'm like, what? I'll share this again. Can you see him there?
Oh, that's good. You got it.
All right. It's not full screen because when I went full screen, I don't know why I wasn't showing anymore, but
No, you're okay. You're okay.
I am here in support of the Vermont optometrists moving forward with their laser and surgical procedures, their in-office procedures in Vermont. I have extensive experience in performing these procedures. I'm a 2009 graduate of Pacific University in Oregon, actually a North Dakota boy, born and raised in North Dakota. Spent the first 23 years of my life in North Dakota, did my optometry school in Oregon. And I went down to Oklahoma for my residency training and did my residency at the Oklahoma College of Optometry in 2009, 2010. Joined the faculty at the completion of my residency and have been here in Oklahoma ever since. Have again been practicing for close to 16 years and have been fortunate to have done or supervised students and residents, thousands and thousands and thousands of these procedures that are outlined in the bill that you guys are discussing today, from laser procedures to eyelid injections, removals of various lesions of the eyelids, things like that. So there are currently 14 states across the United States that authorize optometrists to perform laser procedures. And there are 21 states that authorize optometrists to inject lidocaine, local anesthetics, perform eyelid procedures, remove what we call lumps and bumps, lesions of the eyelids, etc. So there's 21 states that currently authorize that. So going forward here, I'm really here to outline education and training. Obviously, I work at a school. I'm the dean of an optometry school, and I can tell you about the training and education that currently happens in optometry schools. I will tell you that every optometry school across the nation, every single one of them, trains their current optometry students on laser procedures, surgical procedures, these in-office procedures that we are talking about. Training happens at multiple levels. Training happens in the classroom. You listen to lectures, multiple classes, and go through all of the didactic and theory and how this works and how you should do that. That happens in the classroom. Watching videos of procedures performed. But after you go from the classroom, you need to go into the laboratory. Laboratory workshop, hands-on training, which all optometry schools, again, are in the classroom. All optometry schools are doing hands-on laboratory training. You can see this photo here of optometry students getting trained on laser procedures. This procedure is called an SLT, or a selective laser trabeculoplasty, which is a laser that Dean talked about that's done for glaucoma to help ease the burden on patients having to take eye drops, helps to lower their eye pressure. So laboratory hands-on training on model eyes that are developed by ophthalmology, used by ophthalmology, and used by optometry in every single optometry school now as well. So again, training starts in the classroom. It goes to the hands-on laboratory training that you just saw, testing on both of those. Our students have written testing. They have laboratory testing where they basically have to walk into a room and there's a proctor there that goes, okay, demonstrate how you would do this procedure. What would you put in before the procedure? What drops would you put in after the procedure? Take me through the steps and perform the procedure on model eyes. Again, every optometry school in the nation is doing number 1, number 2, and number 3. And then in Oklahoma, we have a law that allows us to do number 4, actually treat patients in the clinic. When I am done here with this testimony, I'm going to walk down. I'm in clinic this morning. Somebody's covering my clinic right now, and I'm going to, for the rest of the morning, be performing laser procedures with our optometry students in clinic. And you can see them performing actual procedures, whether it's an SLT, whether it's a YAG capsulotomy, a laser peripheral iridotomy. Those are the laser procedures outlined in this bill. Again, they are performing these procedures on patients. We're doing this in Oklahoma, in Kentucky, in the states that allow us, because we have a law to do that. So you can't penalize the New England College of Optometry, the Massachusetts College of Optometry, the State University of New York. They train in the classroom. They train in the lab. They test their students on that, but their law doesn't allow them to do these procedures. So when somebody tells you, perhaps an opponent tells you, well, they don't have the proper training because they don't do live procedures. Well, the law doesn't allow them to do live procedures. And then you say, well, we can't change the law because they don't have the proper training, but they can't get the proper training because the law doesn't allow it. You see, you're caught in a catch-22 there. Now, fortunately, again, for us in Oklahoma, we have a law that allows us to go to all 4 levels of this training. So in the classroom, in the laboratory, extensive testing, and then treating patients in clinic. Again, students are having this at all of the optometry schools to the highest level that the law allows them in each individual state. Okay. So the question then becomes, well, what happens if a doctor graduated 25 years ago or 35 years ago? Education, as Dean said, it continues beyond the day that you graduate. I graduated in 2009. If I practiced to 2009 knowledge, I'm guessing none of you would want to see me as an eye doctor. I mean, we continue to evolve, and that's why we get continuing medical education every year. I'm fortunate that I lead what's called our laser and surgery course, our advanced procedures course, ophthalmic procedures course. Those are just different names for the same course. We have traveled, and here's me preparing to do a laser procedure. I show this picture because this is very, very similar, the same skills as a slit lamp exam. Every single optometrist in the country, every single optometrist in Vermont has a slit lamp or multiple slit lamps. So you've probably had your eyes examined. Put your chin in here and your forehead up against the forehead rest, and they examine your eyes. These lasers, that's a laser right there. And it has very, very, very similar skills as doing a slit lamp. So education and training would certainly happen in Vermont when you guys pass this law and bill. But I can assure you, after training optometrists in 49 of the 50 states, that much of the skills are already there. They will build upon the skills that they have learned through 4 years of optometry school and all of their clinical practice and build on this to add a new skill. But the foundational skills are slit lamp and putting a lens on the eye when you're performing these laser procedures. Again, training continues after your schooling ends, after your formal education ends. This is our advanced procedures course, our laser and surgery course, our ophthalmic procedures course. Again, I mentioned 3 different names for it. This is a 32-hour intensive 4-day course that we have put on in 37 of the 50 states. Every single state that has authorized these procedures, the 14 laser procedures, the 20 plus states that have injections, have required that 32-hour course. If you look into your laws, you guys were reviewing that law, that 32-hour course for doctors that graduated 2019 and before, it's modeled exactly after this course. I've headed this course for the last 15 years, and I'm happy to answer any questions on this. We've actually had numerous ophthalmologists involved in this. We did this course in the UK, in the United Kingdom, as they have expanded and are doing laser procedures in the United Kingdom. And there was an ophthalmologist involved in this course that provided a laser, and you can see his quote at the bottom. He said, "Boy, I wish we had training this good when I started performing laser procedures. I was basically shown the laser and said, go ahead and start doing it." He goes, "I wish we had training like this." So to sum up, training not only happens currently in optometry school in 2026, but world-class education and training happens for doctors that graduated prior to 2026 and prior to 2020 as well, with postgraduate secondary training, doctoral training, as you can see with this course here. In my last few minutes here, I want to mention a couple of different procedures. SLT. This is a laser procedure done in the office for glaucoma, and this has now become first-line therapy for patients. When patients come in and they are diagnosed with glaucoma, historically, they were often put on drops. It was Mrs. Jones, Mr. Jones, we have got to take a drop or 2 drops or 3 drops, and that is a burden on patients. The literature has been very, very clear now that SLT, this laser that Vermont optometrists are asking for, that 14 other states authorized optometrists to do, it is a first-line therapy, meaning it should be done first line and helps to ease the burden on patients. And there's huge studies out there. This is the LIGHT trial. Every optometrist and every ophthalmologist across the country has heard of the LIGHT trial. And this was released in 2019. And it said, you can see the conclusion, the yellow arrow. SLT not could be, it should be offered as a first-line treatment, meaning let's not go to drops first every time. It's not drops and drops and drops that they have to take every single day. We have a laser that we can do in the office that helps to lessen or eliminate their need for drops for periods of time. This should be offered as first-line therapy, supporting a change in clinical practice. If I ask Dean, I said, "Dean, who treats glaucoma first line in the state of Vermont?" And Dean's answer would be who? Who treats glaucoma first line?
Always optometry.
Optometrists do. We have wonderful glaucoma specialists, but they are reserved for moderate to severe glaucoma. When they need surgical procedures, optometry treats glaucoma first line. And we have 2 wonderful first-line treatment options in glaucoma. We've got some wonderful eye drops, and we have a wonderful laser as well. And the first-line glaucoma eye providers in Vermont, optometrists, should be able to make the determination along with their patient, what is better for Mrs. Jones or Mrs. Jones? Is it a drop in this instance, or is it a laser as well? So, it'd be a huge public health win, in my opinion, for the citizens of Vermont if optometrists were allowed to use SLT, because they are the first line providers. I'll go back here. huge public health win. Okay. I do want to, in my last couple of minutes, outline there was a couple of questions. Are there studies out there? Can you guys see this study, this original investigation, YAG laser capsulotomy?
Yeah.
Okay. This is published research, peer-reviewed published research of one of the laser procedures, YAG laser capsulotomy, efficacy and outcomes performed by optometrists. 99% of patients in this study reported a visual improvement. 99%. And you can see the conclusion based on the outcomes of this study. YAG capsulotomies are effective treatments to improve patient vision that can be safely and effectively performed by optometrists. There were no complications in this study. This was a study that did compare data of optometry to the ophthalmology published literature. That's what this table is looking at. Of these 20 published studies, this study that was published by optometry was the 5th largest. So it's not like we did a small study and the rest of them were big studies. It was the 5th largest study. It found the exact same starting visual acuities and the exact same ending visual acuities as the ophthalmology studies, meaning patients started 20/40 with 3 lines reduced vision and improved to 20/20 after this procedure there with no complications with this. So yes, there is published literature out there on these exact procedures that they are talking about in Vermont. This was another one that was referenced: establishment and review of educational programs to train optometrists in laser procedures and injections. We looked at and contacted every single state board that has already authorized these procedures.
Excuse me, you need to exchange seats with our reps. Thank you. Sorry for the interruption. Please keep going.
No problem. We contacted every single state board that has previously authorized optometrists to perform laser procedures. That would be Oklahoma and Kentucky and Louisiana and Indiana and Mississippi, et cetera, et cetera, et cetera, and said, how many complaints have been filed? How many lawsuits have been filed to the Board of Examiners, to health institutions like OPW? And we published this study. This was electronically published in the summer of 2024, published in print early in 2025. And you can see as of 2024, if you guys can see the highlighting here, the outcomes of over 146,000 laser procedures have been reported by optometrists to the various state boards with 2 negative outcomes, 2 complaints, 2 lawsuits at this point. That is 2 out of 146,000 procedures. As you all know, certainly in medicine, things can go wrong. Have I had a complication of laser procedures? Absolutely. I've had one of those before in the thousands and thousands and thousands that I've done. And I contacted one of the ophthalmologists in 2011 when I had that first complication. And he said, Nate, the only way you're never going to have a complication is what? To not do the procedures. So if you do procedures, you're going to have complications. Fortunately, they are very, very, very rare. 2 out of 146,000 in the published literature, proving a very, very strong safety track record in the 14 states that authorized this. With that, I think I have covered everything.
Okay.
Questions for me?
Thank you. That was really very well done. We appreciate it. And if you could please send us your testimony slides, so we'll have it for the record, that would be very helpful.
Sure.
I do have 2 questions for you. From your perspective, obviously you're in a different situation from the local optometrist at Northeastern in Oklahoma. I have 2 questions. One, the patients with complex, and this is a question that will probably come up ongoing with folks, whether they're optometrists or ophthalmologists, which is how you deal with patients with complex diagnoses. So someone that's got cancer, has had a stroke, has high blood pressure, has like glaucoma, not an unusual thing as folks get older.
Sure.
And the training that you have there. And what I would ask is, I'm asking this kind of generally, I think, for anyone who's going to be testifying.
Well,
Thoughts there briefly.
And that's part of all the education and training that optometrists have, that our students have. Not only are they trained in laser procedures and injections, we are trained in systemic disease and every systemic disease that can affect the eyes. You wouldn't believe the amount of patients that we have that have high blood pressure and high cholesterol and uncontrolled diabetes and strokes of the eyes. And our students are incredibly well trained on this. Not only do they have what I'm going to go down to laser clinic here in just a little bit, they have diabetic eye clinic and glaucoma clinic and ocular disease clinic and acute care walk-in clinic, where anything walks in from the piece of metal in the eye that we have to remove to somebody that just had a stroke and can't see in part of their vision, and they are trained to handle all of that, to handle all of these medical complications that go with this. Yeah, it's unusual to see a patient that needs a YAG laser capsulotomy to clear that cloudy membrane. They're usually what age? In their 60s, 70s, 80s, and they've got high blood pressure and they have high cholesterol. And you evaluate all of that as part of your general medical eye exam, looking at the front of the eye, the back of the eye, and making sure that the benefits of a procedure outweigh the risks of a procedure. For example, if I have a patient that has extensive diabetic macular edema, they have diabetes and they have swelling in the back of their eye, I'm going to postpone that YAG laser capsulotomy until the macula is taken care of by a retina specialist to take care of that diabetic macular edema. Does that make sense? So you look at all these different things and evaluate their medical history and make a decision as the doctor when you include all of the totality of all those things. So yeah, they're incredibly well trained on all of these complex systemic conditions and how they affect the eyes.
Thank you. I have one last question, if you could answer very short for me.
Sure.
One of the things that you said was that the laser surgery would preclude the need for drops.
Mhm.
And that, so you would go right to the laser surgery rather than have the drop. You said that. So on principle, do you work from the least invasive treatment first or not? So that's just a yes or no, really, but we can get into that another time, I think, with folks who come in.
We offer the two scientifically proven first-line therapies, which is drops or lasers. So we offer both of them to them and explain the pros and cons of both. The laser certainly is more invasive because you have laser energy going into the eye, but the way it works, it is incredibly, incredibly gentle. You can't even tell you've had the laser procedure done. And the offset of maybe it's more invasive is the benefit of having a laser once a year, once every other year, once every 3 years versus taking drops every single day. So we make those decisions together with the patient.
Okay, thank you for that. All right, good. And thank you all for today. This is the beginning of S64. We have more testimony scheduled, beginning with some ophthalmologists next week, and we'll continue to look at the bill together so we can fully understand what the procedures are and what the other provisions of the bill are. So we're going to move on right now. Thank you all. So we'll change the room because we're moving to immunize people.
Yeah, we want to run.
Yeah, they should do that. Oh, it's lovely. It's lovely. This is like if you just say, I have the.
Oh, you did?
Yeah.
Thanks. Thank you.
You're doing it.
Now I know what I mean.
I didn't hear.
She's fine.
Oh, there is.
Oh, she's about
Good, good.
Through this. So you.
Well done.
Well, yeah. The job.
Yeah, there's way too many,
Absolutely. Especially if we don't get run. Yes.
Yeah.
Okay, yeah.
It's
It's just.
Amy.